Diabetes foot ulcer. Diabetic foot ulcer are a serious complication caused by a combination of poor circulation, susceptibility to infection, and nerve damage from high blood sugar levels. When there is limited blood flow to the wounded area, the body struggles to heal its skin wounds, so these wounds develop into diabetic ulcers. Diabetic ulcers are more prevalent among diabetic elderly. It is estimated that a quarter of people with diabetes will develop a foot ulcer at some stage. Unfortunately, a quarter of those with ulcers might end up with amputation. Diabetic ulcers are a long-standing problem. In some cases, the wound might not heal and get infected. The body tissue die, and this can lead to gangrene. Diabetes mellitus can be virtually harmless if controlled, but the state of abnormally high blood sugar levels associated with the condition can lead to some serious complications. If the high blood sugar is left uncontrolled for a long time, or if a diabetic patient fails to adapt their lifestyles in order to manage the disease, they will have more difficulty preventing complications from occurring. One of the serious complications that diabetes may encounter are diabetes wounds or diabetic ulcers. The main concern with diabetic wounds is poor or delayed healing. Healing problems are caused by the peripheral artery disease and peripheral neuropathy that can occur with diabetes, wherein the blood vessels in different parts of the body, especially the hands and the foot, grow narrower and reduce the blood circulation to those areas. A lack of circulation in the extremities can result in a reduced supply of oxygen and nutrients to the body tissues and nerves in these areas, which is necessary for healing. Over time, nerves in those areas become damaged, decreasing the sensation of pain, temperature, and touch, making patients vulnerable to injury. The diabetic foot is considered one of the most significant complications of diabetes, representing a major worldwide medical, social, and economic problem that greatly affects patients' quality of life. According to some reports, foot ulcers will develop in about 1 in 4 people with diabetes. Foot ulcers are painful sores that can ultimately lead to foot amputation. The risk for a patient with diabetes to develop foot ulcer is close to 25%, leading frequently to disablement and leg amputation. According to a 2020 article, diabetics contributes to 25 to 90% of all amputations with studied population. It has been estimated that every 30 seconds, a lower limb is amputated somewhere in the world because of diabetes. The link between diabetes, foot ulcer, and leg amputation is indisputable, as diabetes is the cause of almost 50% of all non-traumatic lower extremity amputation worldwide. Diabetes neuropathy and peripheral vascular disease are the main etiologic factors for diabetic foot ulcers. How or why does diabetes interfere with wound healing? Research shows a clear correlation between blood glucose and wound healing. Diabetes impairs how the blood produces or responds to insulin, a hormone that allows the cells to take and use glucose from the bloodstream for energy. This disruption to insulin makes it more difficult for the body to manage blood glucose levels. So when blood glucose levels remain permanently high, it impairs the function of the white blood cells. White blood cells are central to the role of the immune system. When white blood cells are unable to function correctly, the body is less able to fight bacteria and close wounds. Uncontrolled diabetes may also affect circulation, causing blood to move more slowly, which makes it more difficult for the body to deliver nutrients to wounds. As a result, the injuries heal slowly or may not heal at all. Diabetes can also cause diabetic neuropathy, which can affect wound healing. Uncontrolled blood sugar can damage the nerves, numbing sensation in the area. This may mean that people with diabetes who sustain trauma to their feet might not be aware of the injury. A combination of slow healing and reduced sensation in the area significantly increases the risk of infection. Diabetes might also affect wound healing in other ways, such as reducing the production of growth and healing hormones, decreasing the production and repair of new blood vessels, weakening the skin barrier, reducing collagen production. If an untreated wound becomes infected, the infection may spread to the muscles and other surrounding tissues, leading to osteomyelitis. It can also lead to gangrene, a common cause of limb amputation, or it can even lead to sepsis, which is life-threatening. So the best way to prevent the development of food ulcer is to control your diabetes by following your doctor's recommendation for treatment and making the necessary lifestyle modifications that include having a healthy diet, regular exercises, and regular monitoring of blood glucose levels. You also need to inspect your feet and hands daily so that once there is an injury, you can easily meet your doctor to take care of it. So people with diabetes are advised to regularly check the body, especially the toes and the balls of their feet, for any cuts. Don't delay treatment of any wound, no matter how minor. Take the pressure from the wounded area. Clean and cover the wound with proper dressing. So 10 steps to prevent diabetic foot ulcers increase: manage your blood sugar, trim your toenails and file down sharp edges. Keep foot clean, dry and moisturized. Wear cotton socks to keep feet dry. Wear comfortable, proper fitting, closed-toed shoes. Leave growth remover to your doctor. Cover your feet and don't go barefooted, even indoors. Eat a healthy diet rich in protein. Stay active and stop smoking. If you like our videos, kindly subscribe, turn on the notification bell so that you get our videos as they drop.